Hi, today we're going to talk a little about facelifts at our practice Faces Plus. This is something we're very well known for, and we're known for producing very natural results. And why is that? Because everybody goes, I've never seen a good facelift, and honestly, that's the whole point. You should not be able to detect a good facelift. Now, a lot of people are worried about incision, and I think incisions in many ways are the things you should worry the least about, because it's really the distortions that occur that draw the eye to see that somebody had a facelift. You won't see an incision, and these incisions, even on the worst healing patients, tend to heal extremely normally without any real apparent visualization. So that's number one. There are many facelift techniques, and I'll cover a couple of them real quickly. Somebody has lots of folds. They frequently need to be detached all the way over to the smile line, sometimes even beyond. But if somebody has very minimal skin tissue, we don't get points for doing more extensive surgery. We get points for doing the right surgery for the right anatomic findings. And so it's not one facelift that fits all. In fact, it's very important that surgeons are familiar with all types of facelifts so they can use the one that works the best for your conditions, which is going to vary based on not only your appearance at the time of your consultation, but at the time of surgery when we make assessments about how tissues in different levels of the face actually move. So this might be undermining that's done even for a mini facelift. And a mini facelift is really determined by the extent of skin undermining and technically by how the deep layer below the skin is handled. Most mini facelifts use techniques called plication or suspension sutures. So this might be plicating the next layer down without removing any tissue. These might be suspension sutures used to suspend the next layer down to have more powerful effects on the neck. And these kinds of plication techniques, called microplication, will often create a volumetric improvement in the cheek area. And that's why these have been used, especially prior to the era of fat graft. Now, as people have more neck tissue, as people have more jowls, as people have more lax tissue underneath the skin, the layer that covers the muscle is called the SMAS, which stands for Superficial Musculo-Aponeurotic System, or SMAS. This is called a high SMAS facelift, and these are really terminologies that are designed for doctors but are used for patients. In this case, the incision in the SMAS, which is under the skin, extends along the upper border of the arch of your cheek. And the SMAS is elevated quite extensively. And you can see once the SMAS is elevated, there's certain features underneath the SMAS, like the parotid gland and certain nerves that are easily moved out of the way so that one can enter the deep compartments of the face. The reason for this is to create vectors that affect the tissue in the neck and the jowls and lead to longer lasting results. Basically, what you should be realizing from this talk is that one size does not fit all. We all age a little bit differently. And one of the things that we pride ourselves on are the ability to diagnose from the surface of your face the underlying anatomic changes that have occurred with aging and spend most of our time rebuilding or reconstructing those, so that in essence we're reconstructing youth and we're making your tissues return to the prior state they were in. So here are some of the incisions that can be used for facelifts. When you look at the person, first of all, you have to see how long is the sideburn. In somebody like Sierra, we may be able, because this distance from here to her hairline is short and the sideburn is a little bit longer than some, we may be able to plan the incision so it actually is in the hair like this. And then actually is not in the groove, but is on the colored part of the ear. So right there, comes into this little corner along the edge of this, which is called the tragus, and just along the attachment of the ear, and where the ear comes behind, we go right up along here. And you can see how mostly the ear is covering, and we make a little transition. So we come right up here. Now in a mini lift, we may stop right here. In somebody who doesn't have a lot of neck tissue, we may go into the hairline. In somebody who's got a lot of neck tissue, this incision is going to come all the way along the hairline and be tucked up so that we can pull all of the neck tissue up here without any distortion, because you don't want to take the lines that are natural here and twist them in any way to compensate for a short scar. You want to make the scar that's necessary. So that really would be the variation with her. Now, if her sideburns were a little shorter, what we would do is we would see where the hair is, and we would come right along just inside the hairline, right up to here. And that way, when we pull the skin up, the sideburn doesn't get chopped off. So those are kind of our incision planning. Now, in patients who require neck surgery, either because they have glandular show or they have a lot of redundancy or extra fat, we make another little incision, not right at the crease, but just below the crease. Just to point this out, if you look at the woman on the screen over here, she's got a very long sideburn, short distance, so her incision is planned in the hair. It elevates the sideburn a little bit, and it doesn't increase this distance to any great degree, and it's still completely natural. In her case, sideburn is short, so her incision is here, and then back here. And you can see she's totally comfortable wearing her hair like that because you don't see incisions, you see distortions. So that's kind of a simplification of facelift in our practice, but something to be aware of, and that's how we plan these things. Little dissertation on facelift surgery gave you a perspective on how we plan these. It's completely customized to you and to no one else, because there's no one like you. So it's important for us to address your nuances, not for us to do things that are cookie cutter, and that's not going to happen at Faces Plus. I hope that this also gave you an understanding that facelift surgery requires an enormous amount of technical understanding and the ability to perform not just one type of facelift, but multiple types in order to get the best results, but yet to pick the simplest procedure for each individual. These are some of the things we can offer. We certainly hope you'll come in and hear more at our consultation, where we can explain why the face ages and the things you can do to prevent that, and also the kinds of things you can do to maintain and treat some of the conditions that bother you the most. Thank you very much.